Excellent.
Good morning, everyone. Can you hear me okay?
Yes, perfect.
So I would like to take this opportunity to thank the conference organizers for giving us the opportunity to present to you how we horizontally and vertically integrated an Indigenous patient scenario in our undergraduate physiotherapy curriculum so we can build cultural and clinical competence in our students. So the Australian Government Aboriginal and Torres Strait Islander Health. I forgot to introduce myself. I am a senior lecturer at the Australian Catholic University, a senior lecturer in physiotherapy, and I've been involved teaching the undergraduate program for the last 4 years. So the Australian Government Aboriginal and Torres Strait Islander Health Curriculum Framework has described 5 elements that should be included in a graduate cultural capability model. And these include respect, communication, safety and quality, reflection, and advocacy. And as such, at the Australian Catholic University, the Faculty of Health Sciences has developed the Aboriginal and Torres Strait Islander perspectives in curriculum. And this is so that we can ensure that our graduates are both competent and confident in the knowledge and responsiveness of cultural diversity generally, but also and specifically in Indigenous perspectives. So what's our physiotherapy curriculum like? It's a 4-year Bachelor of Physiotherapy program, which consists of 3 years of theoretical and clinical content. And then the final year, 4th year, consists of 6 5-week blocks of clinical placements. So what's the educational challenge? Well, for our students and for all physiotherapy curricula is to ensure that the theory and the clinical skills learned in the first 3 years of the program are able to be integrated and applied in a clinical setting during the students' clinical placements. And we need to ensure that this is also done with both clinical competence and cultural competence and sensitivity. So in order then to be able to develop a better link for our students between the theoretical and clinical skills that they're learning, practical skills they're learning in the first 3 years with the 4th year clinical placements, we were able to secure some funding, and we developed a series of films. The films then were used to horizontally and vertically integrate an Indigenous patient as a case scenario across the 4 years. And so the challenge that we faced in developing these films was actually being able to both clinically and culturally represent the patient and ensure that the students are able to link and integrate the two together. So how did we do it? Well, it was a challenge to be able to ensure that we did both of these aspects very clearly, but we were very lucky to secure the assistance of an Indigenous film crew, an Indigenous producer, and Indigenous actors to develop these films. And I'll show you some of these films now so that you can see a little bit better of what we did. But how did we vertically and horizontally integrate the films? So in our semester 1, first year, as soon as the students start the physiotherapy curriculum, they need to learn about communication and appropriate and culturally sensitive communication within the physiotherapy context. So film 1 goes into year 1, semester 1. I'm not going to describe all this in great detail now because I'll be showing you some examples. But film 2 then is presented in semester 2 of year 1. And that's a short extract that links the content to what they learned the next year as well. In year 2, semester 1, they learn how to assess the patient for knee osteoarthritis. So the patient that we developed is Mrs. Peggy Williams. Mrs. Peggy Williams is a lady in her 40s who comes from Burke, and she comes to Brisbane for the first time to referred by her doctor to see a physiotherapist. She has developed knee pain because she had an injury when she was younger that she never had treatment for. And so she's now, because of her knee pain, she's not able to go on her walkabout. She's not able to meet her responsibilities caring for her parents and her children. And she's also an elder in the community. And so she needs to then get some treatment to be able to participate in her community as an active member. So we need to then assess her for the pain in her knee, which has been diagnosed as osteoarthritis. Mrs. Peggy Williams also needs to have her fitness assessed, which is done in semester 2 of year 2. But because she's been limping around for a long time and she's not able to do as much exercise or physical activity, she started developing low back pain. And hence she's in year 3, the students meet her and assess her for her low back pain. And then because she's once again continuing to experience problems, she was also had risk factors for developing other comorbidities. In the 4th year, just before the students go out on their clinical placements, they actually meet Peggy again, or Mrs. Williams, and they work within the healthcare context on how to manage her complex conditions and comorbidities. So this is the first film, and I'll show you an extract of the film 1, which is called Story 1. It's an interview with a physio that doesn't go very well, and this is the first film the students experience within the first month of commencing physiotherapy. And then they also see the second part of the film, which is how the physio interview should go when there is some cultural awareness. So now let's see how I can share the, sorry, am I sharing audio?
We can see the video, but I can't hear anything yet. Have you pushed play?
No, I haven't. I think, I'm not sure.
No, we're not hearing the audio.
No audio?
No, doesn't sound like it.
Okay, I need to share audio when I share screen. Let me just see. My apologies, I should have done this at the very beginning. Here it is. Video, screen, share computer sound. Okay.
And we're viewing your PowerPoint presently.
Yeah, so I'll bring the video back again. Sorry, I might need to exit just slightly so I can bring the video.
Hi, I'm Chris. I'll be working with you today. Just come with me to the treatment room.
So as you can see, the physiotherapist is walking.
Mrs. Williams, just come and take a seat. Oh, it's okay. We'll take it from here. It'll only be an hour or so, so just wait in the waiting room and we'll come and get you. Pop down on the green chair there, Mrs. Williams. Well, as I said, I'm Chris. What can I help you for, Mrs. Williams? All right, well, let's start with, what did the doctor ask you to see me for today? So, Mrs. Williams, I'm going to need a little bit more information on that. Can you tell me about where the pain is and how bad it hurts?
It's my knee.
Oh, that's a start. Well, which one is it?
This one.
Is it about here that it hurts? Mrs. Williams, I'm going to need a bit more information. Can you give me anything else? Okay, well, I'll be back in a minute.
So just for the sake of time, I'll now move it forward slightly.
Mrs. Peggy Williams, please. It's okay, stay there a moment, Mrs. Williams. It's all right. Hi, my name's Chris, and I'm going to be your physiotherapist today. I understand you notes you've never seen a physiotherapist before?
Yeah, that's right.
Okay, well, what we'll do, my office is just around the corner here. We'll get you to come with me, and I'll talk about a bit more what we're going to do today as we get in there. Does that sound okay? All right, so if you just help your mum and come with me, and we'll walk down to the office. That's it. Nice and easy. All right, off we go. As I said, the office is about a 10k stroll down the corridor. So if we put our 10-metre pedometer, so we'll just come on down here. Okay, Mrs. Williams, just come and have a seat here, and Kate, just sit next to her there on the orange chair. All right. So, Mrs. Williams, whereabouts are you from? Do you usually live in Brisbane?
I'm in Brisbane visiting my eldest, Kate. She's at uni here.
Oh, fantastic. Who are your people?
Barkinjimel,
Whereabouts is that?
Burke in New South Wales way.
Oh, how are you finding the city?
Oh, too busy for me, eh? Too many people. I think I'd rather be back home.
Yeah, I'm from Canberra. My family are back there. I miss them terribly, so I can relate to what you're talking about. So, Mrs. Williams, what I would like to do is ask you a few more questions about some background information for me to come up with a plan for your condition today. Are you okay with that?
Yeah.
So, first question I have is, how many children do you have and how old are they?
2 kids. Kate is 22 and studying nursing here in Brisbane.
So what I do now is I'll go back to the slideshow. So just from that, I hope you've been able to see how, and this is what impresses the students very much, is being able to see at the very beginning how they should not behave, how not showing cultural sensitivity and competence actually alienates the patient, and they're not able to be an effective physiotherapist. Whereas in the second interview, they learn about the importance of sharing the cultural sensitivity, of identifying with their patient, asking where their mob is from, sharing some of their own personal identity as well, and also including the family in the consultation, which is very much a very important aspect of the indigenous culture. So this sends a very powerful message to the students, and they then start to understand this and incorporate it a lot further. And because they meet Mrs. Pecky Williams at the very first semester, very first month they commence the program, they're now able to follow her through the 4 years of the curriculum. So as part of semester 1 in first year, they learn how to assess the muscle strength, for example. So we show them an extract of the film, of the second film that actually incorporates this aspect. So they learn about their skills, but they also can see where they feed into a physiotherapy consultation in its and the process. And then in say year 2, they actually then see the full assessment of the knee as a video, and learn how to both ask the history and do the physical assessment. And they also incorporate in year 2, semester 1, the pathophysiology, or the understanding of what a patient with osteoarthritis experiences and what the pathology entails. In semester 2, they learn how to assess the patient's, my apologies, I'm just going to try and bring the video up, how to assess the patient's physical fitness. And so with this video, then I'll bring this one here. And I'll just share a little part of this one. So the students then are learning once again about including the family and about the importance of having everything explained. And this is also part of our normal practice. So that's the other challenge, and the important thing was to ensure the students not only understood the cultural competence, but also incorporated into their normal practice.
Walking for 6 minutes on a corridor, which is 30 metres long. So there's 2 markers.
So here, the physiotherapist is explaining exactly what's going to happen. And if I move it forwards a little bit, she's undertaking the test.
We'll go out into the corridor now and get ready to do the test.
Just a 1 minute warning, Maria.
Okay, thank you. So you can see now her daughter is there to support her as well, and showing inclusivity of the family. So I'll just escape this one. So then what we do in third year, the students then, because she has developed low back pain, the students are learning about how to assess people with back pain. And so they watch the fourth video, the final video, which is looking at how they're assessing the patient, both for the history as well as the physical assessment. And in fourth year, which is just a week before they go out on their first clinical placement, they then study the complex health issues that Mrs. Williams has developed as part of her conditions that she has had. And they develop how they learn how to manage them, how to refer, how to work with other health professionals, and really incorporate the healthcare context. And I would like to also send a special acknowledgement to my team that actually worked with me on developing the case scenario, the scripts, and a special thank you to Richard Jamison, our producer. He's an Indigenous producer who was provided invaluable insight and feedback to ensure that the films were done with cultural sensitivity. Also, Roxanne MacDonald, our actress, and Marilyn Button, who was the daughter. And of course, my co-workers, Jordan and Chris, who were the actors becoming a sensation overnight. Thank you.
Thank you. That was really awesome. And everyone, you can continue